Listen up, ladies and gentlemen, especially all of you amazing women 65 and older. This is very important. In fact, the manner you speak with your doctor may be seriously endangering your general health. Surprisingly, very few people are discussing this in conversations. In my work over the years, I have seen far too many mature women enter my office and, without even realizing it, compromise the standard of their own medical care by just expressing themselves and talking in certain ways. I'm going to walk you through each of the 7 most prevalent and significant communication blunders that older women frequently make when seeing the doctor in this comprehensive video. More significantly, I'll offer helpful advice on how to address them immediately, so you may receive the consideration and care you so well deserve. Okay, let's get right to the subject. Keep watching until the very end, because even the most astute and intellectual women commit the 7th error carelessly, and it can have serious repercussions. Before we get started, please hit the like button on the video, subscribe to the channel for future videos like this, and leave a comment below with your experiences if you find this useful. Have you ever left a doctor's appointment with the impression that your worries weren't adequately taken into consideration or addressed? First on our list is speaking in an excessively courteous manner, which regrettably frequently results in not being taken seriously enough. I can't even begin to count how many times I've witnessed elderly women walk into my clinic and behave with such sincere compassion, profound humility, and gentle, polite manners that you want to give them a special badge for being the ideal patient that everyone aspires to be. However, I have to tell you the unpleasant truth today. Although being courteous is a virtue in daily life, it doesn't help you in a medical setting if you overdo it. Actually, it can work against you and lower the quality of treatment you get. Let me explain this in further detail so you can see why this occurs. Whether via official training or simply unconscious habits, doctors, especially those employed in busy, fast-paced clinics, are conditioned to rank cases according to perceived urgency. We're not only listening to what you're saying, additionally, we're paying attention to the message's general tone, wording, and delivery. Therefore, picture a situation in which a lady enters the room and begins by saying something along the lines of, "Oh, it's probably nothing serious at all. I really didn't want to bother you or waste your valuable time." Such a comment instantly raises the suspicion that it is not a top priority. Keep in mind that we are also people with busy schedules and numerous patients. Additionally, we may inadvertently minimize your problem in our evaluation if you're quietly implying that it's not a major one. However, this is where things become complex and even hazardous. Many of those seemingly insignificant complaints turn out to be signs of serious health issues that require medical care. For example, what begins as a chronic, bothersome cough may indicate early-stage lung disease, while sporadic lethargy may indicate undiagnosed diabetes that has been brewing beneath the surface. Simply put, it is not your place as the patient to downplay or judge the severity up front. Your main duty is to present the facts in an understandable and direct way. You don't have to appear impolite or hostile. There's no need to barge in and start shouting orders. Rather, strive for direct and confident assertiveness. Put something more powerful in place of phrases like, "I know you're super busy, so I just thought I'd mention this quickly." For example, "I've been dealing with this symptom for the past 2 weeks, and I really need to figure out what's behind it so we can address it properly." This slight change in tone and wording shows that you value your own time, your health, and your body. Consequently, it motivates your physician to reciprocate that regard and handle your issues with the gravity they need, mostly because you're setting an example by appreciating who you are. The second is depending on imprecise or ambiguous descriptions, which regrettably sometimes lead to incorrect diagnoses or problems that are missed. To demonstrate how this ambiguity might lead to poor medical care, let's look at a real-world case. I received a visit from a delightful 72-year-old woman. Her response to my question about why she had made the appointment was,
I just haven't been feeling quite like my usual self these days. Of course, I probed her more. Could you elaborate on the specific meaning of that? Her reply was, I'm not entirely sure, just feeling a little off-kilter overall. I truly appreciated her candor in that moment, but as a physician, I rely on specifics to perform my job effectively and accurately. That common phrase, feeling off, is so broad it could encompass a wide array of possibilities. Things like general fatigue, heightened anxiety, episodes of dizziness, bouts of nausea, drops in blood pressure, irregular heart rhythms, or even the initial subtle signs of dementia setting in. It's comparable to taking your car to the mechanic and simply saying, "My vehicle's acting kinda weird lately," while expecting them to diagnose and repair it without even popping the hood to inspect what's going on inside. I took the time to gently prompt her for more details, encouraging her to think through and describe her experiences more precisely. Eventually, she opened up about having dizzy spells every single morning right as she got out of bed, along with increasing difficulties in remembering minor details like where she'd placed her keys or other everyday items. Those revelations were huge red flags that demanded immediate attention. Upon further evaluation, it turned out she was experiencing low blood pressure stemming from a medication interaction, combined with early indicators of vascular cognitive impairment that could worsen if ignored. If she hadn't eventually shared those specifics, we might have dismissed it all as just the natural effects of getting older, which would have been a missed opportunity for intervention. So, my strong recommendation to you is this. Strive to be as precise and detailed as possible in your descriptions. Before heading to your next appointment, take a few minutes to jot down key information. Note what the exact symptom feels like, when it first began, how frequently it happens, any factors that seem to improve or exacerbate it, and most crucially, how it's impacting your routine daily activities and quality of life. That level of detail is invaluable to your doctor, acting like pure gold in helping us narrow down possibilities. It can genuinely make the difference between your concerns being brushed aside casually and achieving a real diagnostic breakthrough that leads to effective treatment. Number 3, failing to voice your concerns when something just doesn't feel right inside. There's a phrase I hear far too frequently from patients, and every time it comes up, it truly breaks my heart a little. They'll say things like, "Oh, I just assumed it was due to my age catching up with me," or "I didn't want to cause a big fuss over nothing," or even, "I figured this sort of thing is just what happens as you get older." Let me set the record straight right here and now. Just because a symptom or change is commonly associated with aging doesn't automatically mean it's normal or something you have to accept without question. Sure, the process of aging does introduce certain inevitable shifts in the body. Your joints might become stiffer over time. Your sleep patterns could evolve and become less consistent. And your skin may naturally thin out and lose some elasticity. But here's a list of things that absolutely should not be chalked up solely to old age without further investigation. Sudden chest tightness or pressure, unexpected bouts of extreme fatigue, vision that's becoming blurry without explanation, unexplained weight loss that creeps up, new or worsening digestive issues, severe and persistent mood swings, or frequent falls that seem to happen more often. The real risk here lies in what I call normalization, where you encounter a new or unusual sensation in your body, and rather than raising an alarm or seeking clarification, you silently internalize it as part of life. You adjust your habits around it, you push through the discomfort, and you endure without complaint. That kind of quiet acceptance creates unnecessary delays in getting a proper diagnosis, allowing issues that could be prevented or managed early to escalate into more severe, life-threatening conditions over time. For example, I recall treating a woman who finally came in after months of feeling an unusual pressure in her upper chest area. It wasn't excruciating pain, just a noticeable discomfort that she could live with day to day. She had convinced herself it was probably arthritis flaring up or perhaps acid reflux from her diet. But when she eventually mentioned it during our discussion, tests revealed it was actually a partial blockage in one of her coronary arteries, a situation that was precariously close to triggering a full-blown heart attack on any given bad day. The key takeaway: always pay close attention to what your body is telling you. If something feels off or wrong, there's a good chance it truly is, and ignoring it won't make it go away. Speaking up as early as possible dramatically improves your chances for a positive outcome, potentially preventing complications down the line. Fourth on the list, minimizing or downplaying your symptoms out of fear that you'll come across as overly dramatic or high maintenance. There's an under-the-radar epidemic affecting many older women that isn't caused by any pathogen or physical ailment. It's the deep-seated worry about being perceived as dramatic or exaggerating their issues. I encounter this pattern repeatedly in my practice. A woman will arrive with genuinely severe symptoms that are causing her real distress. But instead of laying them out plainly and owning the experience, she'll wrap them up in a series of disclaimers to soften the blow. Things like, "It's really not that bad, honestly," or "I'm probably just overreacting here," or "I'm sure you've dealt with much worse cases than this. Are you able to identify the root cause of this behavior?" In essence, you're trying to shield me as the doctor from the full weight of your suffering. You're attempting to avoid being too much or imposing on others. You're concerned about occupying too much space or time in the room. But allow me to speak from the heart with complete honesty. You are absolutely not too much. Your health concerns are never an inconvenience or burden. Your pain is valid and deserves to be acknowledged without any humor or dismissal. I had a patient once who presented with what she described as mild abdominal discomfort. She even rated her pain level as a 4 out of 10 on the scale. However, her physical appearance told a completely different story. She looked pale, her body was tense, and she was visibly wincing with nearly every slight movement she made. After some gentle encouragement and follow-up questions, she finally confessed that she'd been enduring intense, sharp pains for several days straight. But she hadn't wanted to make a big deal out of it or seem like she was complaining excessively. As it turned out, that discomfort was acute diverticulitis, which necessitated immediate hospitalization and a course of strong antibiotics to resolve. If she'd voiced the true extent of her symptoms sooner, we likely could have caught and treated it in an outpatient setting, avoiding the hospital stay entirely. The point is, downplaying what you're going through doesn't demonstrate strength or resilience. It actually complicates our ability to provide the help you need promptly and effectively. So I urge you to paint the complete, unfiltered picture for us. If the pain is hitting an 8 out of 10, declare it as such without hesitation. If it's disrupting your sleep and waking you up multiple times at night, mention that detail. If it's influencing your mood swings, your appetite levels, or even your mobility and daily routines, share every bit of it openly. You fully deserve to have your experiences validated and addressed seriously. And that process begins with you committing to treat yourself with that same level of seriousness and self-advocacy. Number 5, allowing someone else to take over and speak on your behalf when it's not necessary or appropriate. Let me clarify this upfront to avoid any misunderstanding. There's absolutely nothing wrong with having a family member, friend, or loved one accompany you to a medical appointment. In many situations, I actively recommend it because an extra pair of ears can pick up on details you might miss in the moment, and it provides emotional support during what can be a stressful experience. However, I've noticed a concerning, subtle trend among older women that raises red flags for me. At some point, perhaps due to habit or deference, many begin to relinquish control of the entire dialogue to their adult children, spouses, or caregivers. In doing so, they inadvertently surrender the narrative of their own health story, which can lead to inaccuracies or oversights. One particular appointment sticks out in my memory. A daughter escorted her 75-year-old mother into the office. The mother was fully capable, cognitively sharp, able to think clearly, and express her thoughts without issue. But the daughter jumped in to answer every single question I posed before her mom even had a chance to respond. For instance, I'd ask, "What symptoms have you been experiencing? How long has this been going on?" The daughter would respond, "She's been feeling dizzy a lot." And after approximately 2 weeks, I finally turned to face the mother and asked her quietly, "Do you agree with what has been said thus far?" "Well, actually, it all started around a month ago, and there was one time when I completely blacked out," she said with a slight smile. "That was a crucial detail that had been completely left out, which might have drastically altered our strategy." The main problem here is that when someone else talks for you, they could not be completely accurate. They could inadvertently leave out subtleties of feeling, downplay how bad your agony is, or confuse crucial dates. They may be distorting your tale because they are telling it from their point of view rather than yours. Even worse, if you don't speak, the doctor may start asking your companion questions instead, which will make you feel excluded. In a place where everything should be focused on you and your needs, you suddenly run the risk of being less noticeable. It is crucial that you lead the conversation unless you are experiencing cognitive difficulties or are too ill to actively participate. Ultimately, your health journey, personal history, and body are at risk. Encourage your loved ones to help, but don't give them total control. Speak up. No one else can describe your experiences as authentically and in detail as you can, so if you need to step in, even if it means gently interrupting with something like, "Actually, I'd prefer to explain that part myself." Sixth, failing to follow up with the crucial questions to make sure you fully understand. This may surprise you, but here's a candid observation. Not all medical professionals are adept at providing clear and understandable explanations. It's not because you don't care. Our medical education frequently exposes us to a world of clinical phrases that we take for granted, hasty explanations, and technical jargon. Without always going into additional detail, we use terms like benign, inflammatory, or mild degeneration informally and expect patients to grasp the consequences for their daily lives right away. However, a lot of older women are reluctant to resist because they don't want to come across as demanding or challenging. Therefore, even when they are completely perplexed or unclear on important matters, they end up nodding along courteously and muttering, "Okay, got it." That is a significant obstacle that may result in miscommunications and inadequate health care. Consider this instance. One of my patients came out of one of our meetings believing that her mild stenosis diagnosis was equivalent to a cancer diagnosis. Over the course of 2 weeks, she suffered needless worry, insomnia, and fear of the worse, all because she failed to define the term's precise meaning. Unfortunately, I hadn't gone into enough detail in simple terms during the appointment. This is what I want all older women to understand. You have more than simply the right to unfiltered information. You have a right to a thorough comprehension of the context and meaning of everything. Therefore, don't be afraid to pose insightful queries such, "What does that word mean in terms that I can relate to on a daily basis? On a scale, how serious is this condition? Will things get better or worse over time? Which therapy choices are available for us to consider? Which red flags should I be on the lookout for? What possible effects might this have on my regular activities, such as driving or working out?" Don't simply pack up and leave the office if, at the end of the visit, you're still not entirely sure what the doctor has explained. Pause, ask for clarification, and then, if necessary, question or reword until it makes sense. Keep in mind that your doctor is there to help you. You're not here to make us feel good or to keep us comfortable. You're come to get a clear picture of your physical condition and future plans. The best doctors, in my opinion, genuinely respect and revere patients who take an active role in advocating for themselves. These are usually the people who live longer, healthier lives, manage chronic illnesses better, and avoid unnecessary ER or hospital visits.
Therefore, don't settle for passive acquiescence at your next doctor's appointment. Speak up, take notes while the topic is being discussed, and insist on staying until you understand everything completely. Lastly, the seventh is failing to take notes in advance or leaving without any recorded conclusions. Given how common this mistake is among patients, let's move on to something quite useful. However, it's among the simplest to correct with a straightforward habit modification. Important details invariably go between the cracks and are forgotten when older women arrive at sessions without prepared notes or leave without obtaining written instructions or summaries. This is neither a sign of weakness or a personal shortcoming. It's just the way the human brain works, especially when dealing with sophisticated information overload or under stress in a therapeutic scenario. Take this example from my practice as an example. After diagnosing a woman with mild heart failure, I took a good half hour to thoroughly go over the treatment plan, including new prescriptions, how to keep an eye on her fluid intake, the significance of weighing herself every day to track changes, and stringent instructions on cutting back on sodium in her diet to avoid swelling. She demonstrated careful listening throughout the conversation, nodding in agreement and even verbally confirming that she understood every point we spoke. However, her ankles were visibly swollen when she came back for a follow-up only 2 weeks later.
She didn't remember what fluid retention even meant in her context, and her weight had increased considerably. "You wanted me to weigh myself every day?" was her sincere response when I politely inquired if she had been participating in the daily weigh-ins. During the conversation, those details had just slipped her mind, which, if left unnoticed, may have led to an avoidable hospitalization. Here is a simple guideline to follow going ahead. Before you even show up for the appointment, make sure to write down important details. Make a brief summary of your symptoms, including the dates they started, any specific concerns or questions you would like answered, and any recent changes to your medicine, food, or energy levels that may be pertinent. Actively document the doctor's explanations during the visit, or ask them to write down the instructions for clarity if that becomes difficult. Bring a small notebook and respectfully ask your doctor to write down the important details for you if you have trouble remembering things or if your handwriting is erratic. The majority of us are more than willing to do so, or you can ask your companion to help you properly capture it. After the appointment is over, spend some time going over those notes while they are still current. Keep them in a designated location for convenient access, and remember to bring them with you on subsequent trips for reference. Your health journey is a continuous story that takes years to complete. Additionally, you can use these notes as a personal journal to help you stay organized and monitor everything. Without them, you're relying solely on recollection, which isn't always accurate. To be honest, even doctors forget things if they aren't recorded on paper or in digital form.